No, definitely not a tangent. I think you're going right where we'd like you to go. So in being able to go from like undergrad into Peace Corps in the Guinea, and as you're saying, you were able to publish this paper from going from theory in your class to actually practicing and doing some of this work. What were some of the biggest challenges at that time for you?
Biggest challenges at the time, like while I was
In
in Peace Corps,
in taking
or
things from theory to practice in
yeah.
that work.
Yeah, I think the biggest challenge is you think when I was in Peace Corps, okay, when I went, I thought I was going to save the world, right? I was like, I'm ready. I'm going to be an ambassador. It's going to be great. Like, had these huge, 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 big dreams. And then when I went, I was like, oh, like there's so much you have yet to learn. You came in here thinking you're going to just develop these projects and people are just going to listen. No, think again, like you are coming in as you're black, but like you also are coming in as a westerner, as American, and you carry that identity with you. You don't know the local language. I was supposed to like our they said that you got to learn French and then local language of Malenke. You don't know the local language. How are you going to build relationships and get buy-in from the community? At the time I was working with a counterpart, and he was essentially their community health worker. And we were going and biking to other villages to do like malaria work. So screening for malaria, giving tablets if needed, and then doing a referral to a nearby clinic. But I think through all of that, it was such a struggle because it made me see how small I was in all of this, and it made me recognize how much I needed to learn. And so ultimately, I recognized that me being there actually wasn't supporting the community in the most effective and efficient way. Probably would have been better to train community members to then assist community members than having a Westerner coming and tell them, hey, this is what you do. And you have like very little understanding of the culture and background. And so I made the decision to come back to the States, and I applied for grad school, got into New York Medical College and started my public health degree. And then soon after started working for the New York City Department of Health, where I'm still at now.
Okay. Okay. Well, thank you for sharing that. I think that is very illuminating, and I've heard many stories similar to that,
Mhm.
and people in people's experience in really understanding that it is, especially when you are someone that's an outsider, quote unquote, coming in, and how hard that is to actually do things that maybe necessarily you want, but having the community really hold you accountable, or hold you to like the speed of trust and all those things. And yeah, also heard a lot about, yeah, is this the best model to do this work as opposed to what we try to do here, right? In the
Right.
US, it's like we try to build people up within their own communities. So
Exactly.
so why not do that similar thing? Okay, so you got your bachelor's in international relations,
Hmm.
thinking about like NGO work, global health work. Then you
Hmm.
decide to pursue a master's of public health at New York Medical College. When did you know that like a master's in public health was the thing that you wanted to do, and why did you choose to pursue an MPH in health policy and management?
Yeah, I knew. So I always knew I was going to go back and get my master's. But I knew that I needed to get my master's in public health when I was at Peace Corps. Because I think to your point earlier, um, it was about I when I was there and recognizing how small I was in the grand scheme of things, I was like, you need to learn about systems. You need to learn about organization. Because I saw a lot of little things like, for example, vaccinations not being stored properly. And so you'd have a shelf of vaccines in a hot, heated room. Who knows if they're still working? You'd see like public records, they weren't organized. And so there was a lot of people who had walked up to and they'd be like, yeah, we don't really know what our age is because like our public records are kind of lost. And so that's when I was like, oh, it's not just come here, build a project, go forth. It's you need to understand systems thinking. And that's when I decided to come back and pursue my master's degree in New York Medical College. And I thought that I knew the American healthcare system better. It's a better use of my skills and time, and to help communities, um, marginalized communities, and get them up to up to speed. And I decided on a health policy and management degree just because I thought I was between behavioral health and health policy and management, but I thought health policy and management would be a good way for me to be a leader in this space as well. And so I went for it. Love the classes that I took, and I'm glad that I did that.
Yeah, that's awesome. And Similarly to you, I did a health policy and management concentration with that same kind of focus of like trying to, because I was also a biology major, very micro, microbiome type stuff before, and I was like, I'm gonna do like the management stuff, the systems thinking, because I've never been able to do that, and I think it's really worked out very, very well. So,
Mhm.
and how did your graduate experience prepare you for leadership and program management work that you do today?
Yeah. So would you, like I said, I was in grad school at the same time that I was at the New York City Department of Health. So
Mm.
got in grad school August of 2018, worked at the New York City Department of Health end of November 2018. And so I had the very unique experience of being able to learn and apply it at the same time in my work. And especially during COVID and doing COVID response work, and being at the higher level courses, I was able to apply a lot of my knowledge to the like expanded access to care program, as I mentioned, with project management. Um, so yeah, I hope that answers the question.
Yeah, 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 absolutely. So when you came into the New York Department of Health and Mental Hygiene, am I
Yeah,
saying that correctly?
yeah.
Okay. What was your role, and was that something that like you envisioned that you would work during your MPH program?
Yeah, when I first started, it was not a role that I envisioned, if I'm being quite honest. I was a client services specialist. I was doing health IT work. There was a program called Meaningful Use, which was basically helping providers learn how to adopt, implement, and utilize the electronic health record systems to improve quality, improve it for their patient populations, which I just said a lot, but it was very techy. And so I would have a panel of like 40 providers, and work with them and say, okay, if you do this, this is how we can make sure more of your patients are being seen or following up. And here are COPD alerts, which is saying, don't mix this drug with this drug when you try to refer them for whatever diagnosis you gave them. Um, but I did not expect that I'd be doing that. However, over time, I think like right now I'm in a very happy place and I appreciate the fact that I got that health IT background.